All right, guys, so we're going to start chapter 20, the health promotion of the preschooler. And before we really start digging into the chapter, I just want to make sure, hopefully you've been seeing my post on Canvas over the weekend, just trying to get you ready for this virtual week. If you haven't, you need to start paying attention to that all day, every day, especially between the school hours. So between 8 and 2:30 or 8 to 3:30 on a clinical day, because we're going to have to do those hourly check-ins. So make sure that you are paying attention to those and checking in appropriately so I can get your attendance counted. All right, so now that we've got that out of the way, let's move on to chapter 20. Okay, so preschool developmental period spans from the child's 3rd birthday through the 5th year. So if you remember when we first started getting into these health promotion chapters for each stage, there was a box at the beginning that said what every child's age group is. So oftentimes when I lecture, I refer to, preschoolers as preschoolers, adolescent as adolescent. So you need to make sure that you know what that means when I say that, because you might miss some important information for the exam if you're not paying close attention. So make sure to go back and look at those and get them memorized if you don't already have them memorized. Okay, so physical growth and development, they actually at this stage have a slowing of physical growth. So they gain only about 5 pounds per year in weight here, and they grow about 2.5 to 3 inches per year in height. And if you can go back and remember what we've talked about so far, that's a big difference. So you do want to go and highlight that in the book because that's something that you're going to want to know later. Okay, so the preschooler gains only 5 pounds per year in weight and grows 2.5 to 3 inches per year in height. Okay, the child becomes slightly taller and leaner with an erect posture. Okay, so if that last chapter that we had, we talked about, let's see, let me find the picture. Okay, 329, that picture of a toddler, where they've got their little booty and they've got their little belly that sticks out. So that little posture that they have, the way that they're standing, is what we're talking about here, where they get taller, they get leaner, so their belly doesn't stick out as much. Those muscles are developing a little bit more, and their posture looks more erect as they are getting older into this preschooler age. So just make sure when you're reading through the book and all these different chapters that you're comparing little things like that I'm pointing out to you. That way you'll be able to tell the difference on the final between, preschooler, adolescent, school age, whatever. Okay, so at this point, they have all 20 primary teeth and they begin to shed at the end of the preschooler period. So if you go back, you'll be able to remember that preschooler period is from the child's 3rd birthday through their 5th year. So at the end of that 5th year, we are starting to shed some teeth. Okay, so at this point too, there is a lesser need for those snacks as their blood sugar starts to stabilize more on its own. If you'll remember with the toddlers, the blood sugar is not stabilized well, and so that's why we do multiple snacks throughout the day, just to keep that blood sugar at a good and healthy state. Okay, our vital signs, you've got the heart rate, respiratory rate, blood pressure. I'm not going to sit here and read all these off to you, but do the same thing that I've told you to do so far, where you're just comparing the heart rate of a preschooler to the heart rate of a toddler, to the respiratory rate of a toddler, blood pressure of a toddler, and seeing what significant changes that there are. Okay, some other things that we're going to look at is that they have some maturing immunity, which is why we start administering more of these immunizations. Not that we didn't do them before, but if you'll notice, as they get up and older into these older ages, the immunizations that we give it just seems like there's more that we give. Okay, so patient teaching guidelines when it comes to immunizations. You definitely want to highlight that section and know how to talk to our parents about immunizations, regardless of how you feel. So one of the things specifically, well, actually, I want you to highlight both the safety stat on 350 and the patient teaching communication. When it talks about that patient teaching guideline, pediatric healthcare providers are alarmed that some parents are refusing, delaying, or limiting immunizations for their children. Obviously, this is a controversial topic and everybody has their opinions on it. But once again, we don't get to make assumptions, we don't pass judgments, and we don't get to push our opinions on people. We just get to present the facts. And so that's what this is doing, is just stating the facts of what we know as people who are educated off of evidence-based practice. So you're going to want to look at this whole box and make sure that none of that is new information to you. And if there's anything that you're like, oh, I don't think I knew that, that's what you need to highlight. Okay. And again, that safety stat, make sure that you're reading that and getting that highlighted as well. The other thing on this slide is the visual acuity is maturing. So we've got that 2040 by their third birthday, 2030 by their fourth birthday. I wouldn't make you memorize that specifically. Just understanding in general that visual acuity is getting better as they are growing is good enough for me. This point, though, is a time that we might see visual disturbances, such as nearsightedness, double vision. They could be they could be present this early in the preschool period. So we do just want to try to pay attention to those things and get it taken care of as soon as possible, because we all know in the medical field, the faster we catch something, the better off that situation is going to be. So hearing acuity at this point is 100% intact with no expected deficits. So what should that mean to you? That means that we should be able to do our hearing screenings, no problem, and expect that there shouldn't be any abnormal things. And if there are, then we need to do some further testing, maybe another repeat test, and just continue on. There are certain situations, like let's say they've been sick repetitively where they could have some fluid buildup on their ears and they wouldn't be able to hear well. That in those situations, we would probably do a repeat test before we do anything drastic. But regardless, just know at this stage, we should have 100% hearing acuity intact. All right, so gross motor development skills in preschoolers. So the child will accomplish new independent tasks and will want to showcase these accomplishments to parents, caregivers, and nurses. So as a nurse, as a parent, if that applies to you, this is a very vital time that you should be always paying attention, even if it's repetitive or you might think that it's silly. You really want to give them that attention that they are seeking. They're trying to show you that they're developing that independence, and they do need that affirmation that they are doing a good job. So we want to make sure that we're doing that, which is the second bullet point of just provide praise when attempting a new accomplishment, whether or not the child masters it. That's the key. Okay, so at that point, you want to make sure, let's use something like buttoning and unbuttoning a shirt. Okay. Some of us have issues with that even now as adults. I mean, come on. So if you're trying to teach them how to do that, even if they just get a couple buttons and then they're overwhelmed, then you could just say, hey, you did a good job with that this time. Next time we'll shoot for a couple more buttons and you'll have it down quicker than split. Like it'll be nothing. It's okay. So that's the kind of encouragement that you want to give them of like an expectation that we're going to strive to do our best every time, but it's okay that you didn't get it completely done this time. Like you don't want to make them feel horrible about themselves for not being able to completely button their shirt on their own. So we want to make sure that we're doing that and doing that well. And the big thing that goes along with that is the third bullet point is do not reprimand if the child fails at a task. Frequent reprimands may make the child less inclined to attempt a new motor skill. Okay, so I would probably use we use the buttons again. So as an example, the shirt, let's say that instead of telling them that you're proud of them and they did a good job because they buttoned a few buttons, and that's one of the first times that they've done that, and you, instead of praising them for what they could do, we reprimand them and make them feel awful about themselves. That doesn't always go the way that people think it's going to go. A lot of the times they're going to take that and react negatively, meaning they're never going to want to button a shirt again if you make them feel like they just can't do anything on their own. So all super important. I mean, when you're thinking about these kinds of things, you got to think about all these developmental theories that we're learning about with each age group as we go, and how that would affect these kids at these different stages. So for gross motor skills, for highlighting, you want to look at these last two columns on that table 20.1 on page 351. So under 5-year-old, you want to see like, okay, here's all the things that they should be able to do by this stage. So develop good balance or dress without help, hop and skips well, pulls a wagon, rides a scooter, they can skate, they can play on the playground equipment. Okay, and you also want to look at between the beginning of the 3rd year and the end of the 5th year column and look at all of those things and see like what kind of expectations do we have that we want them to meet by this age. Okay, so make sure that you're highlighting those and looking over them as you're studying. So nutrition, this is a big deal. We want to make sure every chapter we talk about nutrition, and every chapter it's a little bit different than the one before. So you want to make sure that you're pointing out your differences and that you know the kind of things that we should do for each age group. Food consumption is about 1,200 to 1,600 calories a day. So food preferences may still affect nutrition. If you remember back to when we talked about toddlers, they can still be picky and it might not eat super well. So that might still affect the way that this child at the preschool age is eating. So all these bullet points on page 350 under nutrition, you're going to want to highlight and make sure that you know this stuff. Okay, so the food preferences affecting nutrition is the first one. The next one is that we want to ensure intake is well balanced with adequate calories and that they have limited salt and fat and it is exposed frequently to new foods. Okay, so a well-balanced diet. We say stuff like that all the time as nurses, but we want to make sure that we're really, really doing that well at this stage. Okay, so well-balanced diet, having a little bit of this, some veggies, some source of protein, some carbs. You do want some fat, but you want to limit your salt and your fat. You want to make sure that we're getting all of our food groups like we're supposed to. And while we're doing that, we want to make sure that we're also introducing them to new foods. My sister jokes with me all the time, the one that has the 2 kiddos, and they're 3 and 4. right now, and I just watched them this weekend, and I was like, I want to make sure that I've got food that they'll eat. And she said, well, honestly, you're way pickier than they are, so it really won't matter. And that's because she's done a really good job of just introducing every single kind of food and just letting them try different things and do different things. Like there's really not much of anything that they don't like. And of course, I'm not that way. I can be really picky about what I'll eat. So you want to make sure that we're giving them a well-balanced diet and hitting all those food groups. The next one is to provide 2 cups of non-fat or low-fat cow's milk or calcium-fortified plant-based milk per day. Okay, so that might be a little different than what we've heard before. Remember, back when we were talking about the babies, the younger ones, we wanted whole milk because the fat was helping their brain development. And now that we've got that underway, we really want to go for more low fat, non fat milk to help balance out that fat intake in their diet. So make sure that you're paying attention to that. The total dietary intake of fat should not exceed 35% of total daily calories. The goal is really 25% of total dietary fat intake for them. We also want to offer fruits and vegetables at every meal. Like we said, a well-balanced diet. We want to include everything in there. We want to encourage the protein consumption and offer low sugar cereals. Sorry, that threw me off. So when we're talking about breakfast, low sugar cereals, like it would be better to give them something like Cheerios or Rice Krispies or something along those lines rather than Captain Crunch or Lucky Charms or something that has a lot more sugar in it. Once you start giving that to them, like that's what they're going to want. Not that they can't ever have those as they grow older, but we want to start them out on a nutritious diet. So a low sugar cereal is better. The last bullet point on this nutrition slide is that nutritious snacks include peanut butter on graham crackers, which of course you want to assess for allergies, especially if you've never given them peanut butter before. Celery sticks with cream cheese, carrots dipped with ranch dressing. There are like 1,000,001 kinds of different nutritious snacks that we could give, rather than doing, I don't know, gummies is what always pops in my head. Gummies or cookies or chips or whatever. There's always, like, especially now, it seems like there's a better alternative to those things than just like a chip, for instance. They have like those rice chips now that are better for you, or even some gummies. They have like all natural fruit gummies that don't have all the extra additives in them. I mean, that would be an okay nutritious snack to give. You just have to kind of weigh, you know, every situation is going to be different. So it just depends. But we want to give our parents some nutritious snack ideas like the ones listed here on the slide. Okay, so food allergies may cause anaphylaxis. I believe you all know this, so I'm not really going to go into this. I feel like we've talked about the signs and symptoms of anaphylaxis, but if you don't, here they are: hypotension, severe airway edema, lightheadedness, bronchospasm. Of course, there can be, it's like a typical allergic reaction, so rashes and all that jazz. Some people will say they have a feeling of like numbness in their face and their hands. So you just need to know what those are and how to explain that to our parents, especially if they're trying new snacks that they've never tried before. That way they can get immediate medical attention. Any food allergies, of course, must be reported to child care centers or preschools. So here's the thing. I'll use the camp as a prime example of this. Every year when the kids sign up for camp, there's a list of their food allergies that they have to tell us. And their parents will tell us what their food allergies are, how severe it is on a scale of like, I don't know, 0 to 10 or something like that. And obviously 10 meaning they're going into anaphylactic shock if they get anywhere near the stuff. So I would have some kids that would have, we'll use tree nuts as an example because that seems to be one of the more common ones. They'll have like a tree nut allergy and they'll just break out in a rash. But then there's other kids who will have a tree nut allergy, and that, let's say I ate a peanut butter sandwich and I didn't wash my hands. I go and touch the doorknob, and then they go and touch the doorknob after me, and they get that peanut oil on their hands, and that could send them into anaphylaxis. Some kids truly are that severe. So you really need to pay attention to the severity of the allergy, especially if they go into anaphylaxis. Like we need to make sure that we're intervening and teaching our parents like what we need to do and how we need to handle this. And of course, the last thing is that a child with a severe allergy should have access to 2 EpiPens, with one at home and the other at school. Provide training in the use of EpiPens to caregivers. So let's say we've got this kid with a severe tree nut allergy. They're at preschool. We need to teach the preschool teacher how to use EpiPens, which honestly, schools teach teachers how to do that anyway. My mom works in the school. She's been in the school system for years. She has EpiPen training like every year. So odds are they already know how to do it, but it's our job as nurses to make sure that the parents know how important it is that everyone in that child's life that's an adult that's going to be with them for periods of time, babysitters, teachers, any caregivers, whatever, they all need to know how to use the EpiPen correctly. So you need to ask the teacher if they know how to use it regardless. If you assume that they know, we would rather want to know that they know. Okay. So, nutrition continued, establishing mealtime with family members. Okay. The child should have his or her own seat at the table without electronics, and they should engage in conversation during at least one meal per day. Okay, so once again, here we go getting into controversial topics, but this all has to do with the mental health component of this child. And your job as a nurse is to treat the child in every aspect of their life. So mental health is obviously one of the biggest aspects. And if you've learned anything throughout PEDS and mental health itself, you should know that this is becoming a serious issue. And the kids are getting younger and younger and younger with like having these serious like depressive symptoms and anxiety problems and whatever, you name it. It's more and more and more abundant every day. So that being said, think about what happens when you sit at the dinner table or you go out to eat. You go to Texas Roadhouse with the family and you just give the kid the phone so that they'll sit there and play the game and not engage in conversation at that meal. Even though they're probably doing what they would like to be doing, they still feel ignored, disregarded, in a sense, just by giving them something and not being a part of like what's happening. You want to include them in anything and everything that's going on, especially when it comes to meals. Something that I heard today is so funny that it's really interesting what happens as human beings when we sit around a table together and eat. Like our whole demeanor changes and the way we choose to approach conversations with people. We think about things more and it's different. There's a vulnerability to sitting at a table and eating a meal together. And it's same for the preschoolers at this age, or really children at any age. But we want to make sure that we are engaging them in these conversations. The next thing that we want to talk about is obesity. So be alert for signs of obesity. So just the same as mental health is increasing as a problem that we see more and more and more in our pediatric patients, so is obesity, unfortunately. Okay, so here's some of the stuff that you need to know. We want to avoid those high-fat diets and fast food consumption. Okay, so while it is easier to run through the drive-through at a fast food restaurant than go home and like cook a whole meal, there are like so many devices out there now, like air fryers and whatever, that like you by the time you get home and put it in the air fryer, it's just as fast as going through a drive-through now. So, and ultimately it's cheaper to cook at home than it is to eat out all the time anyway. But most fast foods are high fat content. So we want to make sure that we are watching that and limiting the amount of times that we eat fast food. We also want to encourage the child to eat a variety of nutritious foods. We've already talked about that, so I'm not going to be repetitive here. We want to provide time for physical activities and vigorous play as well. So once again, this is another thing that we don't do super well in America. Of course, I'm not saying that everybody doesn't do this well, but since obesity is a problem, obviously some of us are struggling with this, and it's the ability to want to take your kid outside and just like run around and play in the backyard, kick a soccer ball around, shoot a basketball, play some badminton, whatever. Okay. Something about getting outside and running around is difficult for us, but regardless of the difficulty and how tired we are from our own jobs, if you'll remember when we were kids, well, for the most of you that are close to my age anyway, you'll remember that Disney used to say, get out and play for an hour a day. Okay, so, I mean, what's an hour? I mean, even if you did 15 minutes here, 15 minutes there, or 30 minutes here, 30 minutes there, that's better than nothing. So you want to get out there and play and do some physical activities to help beat obesity. Of course, one of the things that we can do for nutrition in general and also to help with the obesity is the choosemyplate.gov. I really don't feel like I need to cover this well because you've been talking about Choose My Plate since freshman term. But it's there in the book, so make sure you know what it is and understand it well. Okay, this just provides ideas for healthy meals and snacks if parents aren't sure and you can't come up with, much more than the basics. You could send them this as a resource that they can use. It also teaches them about food safety rules. So it's just a good resource to give these parents. Okay, so sleeping patterns and requirements. These kiddos need 12 hours of uninterrupted sleep per night. Okay, that's something that you want to highlight. 12 hours of uninterrupted sleep per night. You want to provide a bedtime routine and possibly a nightlight. I don't feel like every kid requires a nightlight, but a lot of them do. And there's something about waking up and everything being dark and it's kind of scary and they don't always know exactly where they are right off the bat. So it would be good if we could, give them a little nightlight in the hallway so they can get to the bathroom if they need to get to the bathroom or whatever. You also want to slow down the activities and avoid television before bedtime. Okay, so let me set this up for you when it comes to sleeping and how just a good example of things that you could do. So let's say you've had dinner was at 5, bedtime's at 8. So for the next maybe hour to an hour and a half, we can let them just go outside, run, play, do whatever they want, be rowdy, do whatever. Okay. That last hour and a half, what we want to do is maybe find a movie or a show that lasts, a 30-minute, 15-minute show like Bluey or something. Okay, get them to sit down with their snack and start calming themselves down. It's always good to do like a bath before bedtime or something along those lines, just to kind of get them to go from like wild as a buck crazy to I'm going to slow down and eat my snack and watch my little show, and then I'm going to take my bath and get them all in their jammies and let them brush their teeth. And by the time you get all of that done, it'll be bedtime at 8 o'clock. So you kind of just want to like wind down the day. So it says to avoid television before bedtime. I don't think, let me see. I don't think it says an exact time period of like, don't do it an hour before or whatever. It might. Anyway, um, it's not that they can't watch TV towards the end of the day. It's just that falling asleep with a tablet in their hand is not a good practice to have, especially so young. As we've talked about before, we all know how melatonin works. Your body produces that naturally. When you sit in front of a tablet all night, it's going to affect your melatonin production, which in turn is going to affect your sleeping patterns and cause problems. So for that last probably hour and a half or so, um, we want to try to like not do the television, or at least, that bottom half right before bedtime. We just want to cut off tablet time or TV time and not do that like right before bed, because it takes time for your body to wind down from seeing a screen and not having that right in front of you. Easier said than done though, because I mean, my goodness, we're all adults and we all struggle with that ourselves. Okay, so something else that you might see in preschoolers is nightmares and night terrors. So nightmares are scary dreams that may awaken the child, producing crying, and it may require reassurance and comfort, that everything's okay. And they can go right back to bed and be okay. They might, be scared or whatnot, but you can get them reassured and comfort them and get them right back to bed. Night terrors, okay, so this causes the child to demonstrate great fear, thrashing their arms and legs and yelling, possibly running or walking out of the room or even the house. Okay, so that's a pretty big deal. In these situations, obviously, you're gonna do the require reassurance and comfort again anyway. But the big thing is the reassurance and comfort, and then safety. Okay, obviously, if they're getting up and walking around and they can walk right out the house, they can walk right into the road too. So we want to make sure that that doesn't happen, that we're locking our doors at night, even if we have to put some extra latches where they can't reach, because some kids are smart enough to know how to unlock doors and things like that. You just kind of have to think about the full safety component of things that could happen here. Like, let's say if the bedrooms are upstairs and there's stairs to consider, then we might want to get a gate or put one of those doorknob twisties on the inside of their door or something like that, to where they couldn't go down the stairs on accident in their sleep. Okay, napping. So the child may probably no longer take a nap, but it honestly varies greatly among children. I have heard everything from multiple naps to no naps at all around this age group. Just depends on who you're talking to and what day it is as to what kind of response you get for this. But either way, they may not take naps or they may want to take naps. It just depends on the kid. So most preschool settings allow the early preschooler to nap or rest during the day. And they used to do that in kindergarten, and then they took it out. I don't know if they ever brought it back or not. At last I heard, they never brought it back. And the older preschooler may just need quiet time. So quiet time would be where they could just go to the bedroom, shut the door, read a book, or quietly play with a stuffed animal on their bed or something along those lines. They don't necessarily have to lay down and sleep, but they can go into their bedroom and just have some peaceful, quiet time. And that would be good for them too. All right, so cognitive development. So according to Piaget, the preschooler is in the pre-operational stage from ages 2 through 7, when the child leaves behind completely egotistical thinking and develops social awareness and the ability to consider others' point of view. Okay, so here are the 3 substages of cognitive development. Okay, and you might want to get yourself familiarized with these bolded terms, understand what they mean. So, preconceptual thinking is described as the young child's judgment of their environment and objects by sensory experiences and classifying objects by one characteristic only, meaning like shape, color, meaning, whatever. Okay. There are 3 components to this: artificialism, animism, and goodness, I can't talk. Imminent justice. Okay. I think the slide has it spelled wrong, which is why I'm tripping out over here. But imminent justice in your book, box 20.1, you definitely want to highlight those 3 terms and know them, be able to pick them out one from each other if I were to put it in a question. Okay. Intuitive thinking begins around 4 years of age and is defined as the preschooler's ability to classify information while becoming more aware of cause and effect relationships. Okay. And then symbolic functioning relates to the experience of play and is demonstrated by a child who assigns meaning to an object different than its literal meaning, such as using a pillow for a horsey or a cardboard box for a car, a blanket for a cape. Symbolic functioning. Okay, so hopefully that all is making sense to you as we go. You want to make sure that you understand that preconceptual thinking, intuitive thinking, symbolic functioning, highlight those components of preconceptual thinking in box 20.1 and have those memorized. So imagination and magical thinking. Preschoolers have a rich fantasy life and deep imaginations that they have trouble telling fantasy from reality. So here's another term that you're going to need to know. Magical thinking is the process where preschoolers use their imagination to explain something they do not understand in their complex environment. They may believe that he or she can cause actual events. Okay, so examples of this would be like maybe making up stories and imaginary friends. That's a pretty common one. They may not understand the concept of death, so they might use magical thinking to help explain that process to themselves. Okay, so let's see. I just want to make sure I'm not skipping anything. So in the book, it uses the example, the preschooler will use magical thinking to explain why a sibling has cancer and is hospitalized. He or she may state that the sibling is being punished for denting their family's car for poor behavior. Preschoolers may blame their behavior on imaginary friends, or they may believe that their made-up reality replaces and explains their actual reality. Okay, this is why the other day when I was talking about toddlers, one of the things that we talked about was to not try to rationalize their thinking, because it's not rational thinking. Okay, so same goes for this. Okay, we can't always rationalize their thought process, but what we can try to do is understand their thought process, and see where they're coming from and why they may be reacting the way that they are, and see what we can do to help. Concept of time. So at this point, they begin to understand the concept of like today, tomorrow, and later. but struggles to understand the concepts of like the past, the present, and the future. One goal is to comprehend the days of the week, the months of the year, and the basics of the 4 seasons before their 5th birthday. Okay, I remember learning all of that stuff when I was in kindergarten. So things have changed a little bit since then, but I will never forget when my siblings were younger, trying to teach them the concept of time was always so funny. Time and geography, those had to be two of the hardest things to get them to understand because, we would say, if we were going to the beach, we're going to the beach in 2 weeks. And then the next day they would be like, so we're going to the beach tomorrow? No, we're not going to the beach tomorrow. We're going to the beach in 2 weeks. So, trying to get them to understand those concepts and then also trying to get them to understand, that Florida is not a place in Tennessee, that you have to travel across other states to get there and it takes time, which is also something they didn't understand. It's just a very confusing time for them. So you kind of just have to know that about this age group and just work with them slowly over time. So that goal is to get them to understand the days of the week, the months of the year, and the basics of the 4 seasons before that 5th birthday. Selective attention. So a behavior where the child demonstrates periods in which he or she does not respond to voices, requests, or even to his or her name. Okay, so that this is like what we would call selective hearing. Okay, so you want to know the definition of this, be able to spot it on a question if I were to put it in there. Okay, so let's say that they're really stuck on something that they're doing. Like, I'll give you a prime example. This happened to me yesterday. My niece and nephew came over. We started making bracelets together out of beads. My niece decided she was going to make a necklace for my husband, and she was working really hard because, once again, we're working on those fine motor movements. So she's having to get this tiny string through the tiny hole in these beads and weave them through. She was very much so wanting to be independent and doing it on her own. However, when she got really focused on what she was doing, she did not respond to anything that I said to her. And that would be an example of selective attention. Okay, it's just where they get really focused on other things. It's normal for this to happen, and that's the important thing to make sure that our parents understand. Like, we have a term for this, we know exactly what you're talking about. It's normal, and while we understand that might be frustrating, it's okay. Like, you're not alone in that, and just, educate them on that topic. So I think I covered those other. Occurs when an activity captures the child's full attention. So we talked about that, like making a necklace or doing a puzzle, something like that. And that the normal behavior can be frustrating to parents. So we've talked about that. So language development, communication progress here at 2 years, we're like at 50 words. They often learn through imitation. So I don't know how many of you have small children in your life, but when they start getting interested in learning to speak, they literally watch your mouth move to figure out how to move their own mouth to say the words that we're trying to say. They do that through imitation. At 3 years, they do up to 900 words. 4, they answer simple questions with simple answers. At 5, they'll do child rhymes, use complex and compound sentences. They'll talk in the future tense, and they'll state full name and address. And remember, all of these things that we talk about, that's not to say that these things can't happen before these ages. It's just that we would like for these things to happen by these ages. Okay. So for preferred topics when communicating, okay, and you might think that this isn't really relevant, but in a way it is, because as a nurse, especially if you want to end up working in peds, you're going to have to learn how to communicate with all different age groups, and you're going to have to know what's pertinent to talk to them about and what isn't. So at 3 years, They talk about simple stories describing what they see, what they hear, what they experience. They may not be completely truthful due to their magical thinking. So if you were to try to talk to a 3-year-old, you might just want, like, one of the things I always ask kids, regardless of their age, is like, tell me about your day to day. Like, what kind of things did you do? And that's a perfect open question to them telling you, what did I see? What did I hear? What did I experience today? And of course, there may be some magical thinking added in there. But it's good for you just to get that bonding going with your patients. That way they will learn to trust you over time. At 4 years, they may talk incessantly while exaggerating and boasting. They like rhymes, they like silly words and playing with speech. They may enjoy endless questioning. And then at 5 years, they tell long stories or tales about their daily experience. They may test parents by using profanity or forbidden words. So of course there's like a scale there of what different people go for different things when it comes to profanity and forbidden words. Like shut up was a bad word at my house growing up. We couldn't say things like that to each other, and we got in trouble if we did. So, you just kind of have to figure out like what those boundaries are, and every parent needs to, you know, set the boundary and stay consistent in setting that boundary as a group of people that are taking care of that child when it comes to those kinds of things. You also want to encourage preschoolers to speak and explain their thoughts and to communicate their questions and their needs. Okay, people, let's think about this for a second. If we were to learn to do this better at this age, imagine how much better off we would be now as adults. Okay, and this right here is exactly why I'm saying that the interaction with the parents and the child feeling that they're a part of the family and a part of the conversation and that they have purpose in life and all of that fun stuff leads to this. Like, if we give them the opportunity to speak and explain their thoughts, communicate their questions and their needs, then that is great. Like, we want to teach them how to do that so that they can express how they feel, especially as they get older. Now, of course, not everybody knows. I mean, Lord help, we all don't even know how to do it now as adults. But now that you are a nurse, you're going to have to learn how to help people do this, regardless of their age. But specifically, since we're talking about preschoolers, you want to learn how to help them, like, walk through how they're feeling. Okay, so you want to say things like, I can see that you're upset. Can you tell me why? Or, what kind of feelings are you experiencing right now? You just want to say stuff like that to kind of like leave the conversation open and let them talk about their feelings. Okay. And help them, understand why something might have happened that would have made them upset or whatever. Let's see. The next one is speech problems such as stuttering, lisping. They should be identified and they should be treated as early as possible. So it's the same thing that I said earlier. The faster we catch a problem and get it treated, the better off we're going to be. So we want to get that taken care of ASAP. Okay, so numbers, colors, and letters. At this point, numbers 0 to 10 should be identified before the 5th birthday. Identifying colors becomes a game, and mixing colors is exciting and cool. We want to begin to copy simple shapes, stick figures, and numbers on paper. And we want to encourage the preschooler in doing these activities, giving them something to do instead of just, I don't know, I don't have an example of all the things that you could give them to do aside from this, but anytime that they could be having fun, they could also be learning while they're having fun. So you just find ways to make things more enjoyable, like matching games and different things like that. Helps them see their colors and identify shapes and different things. And that's even a cheap thing to do. Like you can come up with so many different fun, cheap games from the Dollar Tree to be able to do things like this with this age group. The dominant hand is well established by 4 years of age, so we'll be able to tell if they're a lefty or a righty by that time. What you don't want to do is to push them to have one hand or the other. We just want to let them do what they're going to do. So, I mean, there's some kids that can do things with both hands or both feet, like playing soccer with both feet, or they don't necessarily have like a dominant side. So, if we can get that to happen, things in life will be easier for them. Like, for example, if we were to not push that on them, and if they were to become a nurse later in life, then they would be able to put an IV in with their left hand or their right hand, and that would make their life a whole lot easier. Sometimes you can't always get the angle that you want on your right hand side or whatever, and it would be easier if you could do it with your left hand, but your left hand doesn't know how to do anything because you never use it. So hopefully that made sense. So here's some of this psychological growth and development for this age group. According to Erickson, the child's psychological and psychosocial process are initiative versus guilt. The child must master the process of initiating activities that are independent and self-directed. Lack of opportunity may make the child reluctant to try new processes. Okay, a lack of opportunity, I could see you taking this two different ways. Lack of opportunity is in, like, we'll say those in a lower socioeconomic status may not have the same opportunities as other children that are in a higher socioeconomic status, but also those parents that enable their kids, I think is what we're really going for here. So, meaning, let's say we want the kids to do, they're at preschool and their preschool teacher gave them some homework and they're wanting to do it themselves, but you just find it easier to do it for them. So you just do it for them. You're giving them an opportunity situation where they're going to be reluctant to try to do those things because they think that you're just going to do it for them anyway. So you got to be real careful about that in this stage because we want them to be as independent and as self-directed as possible. So once again, we want to support the child in the attempts. Frequent blame or negativity during skill exploration can cause feelings of guilt and decrease feelings of worth. Okay, so some people might believe in this stuff and some people don't. But if you can sit here yourself and reflect back on your childhood and think about the times where your mom or your dad or whoever it was that you grew up with got on to you because you didn't get the hang of something fast enough, like tying your shoes or riding your bike or whatever it was, okay, getting your homework done fast enough, doing anything, okay? When somebody gets on to you like that and it happens over and over and over again, it develops feelings of guilt and decreased feelings of worth. A lot of people end up in adulthood with these feelings of decreased worth. And this is where that comes from. It starts here well, honestly, it could start even before the preschool age, because we had talked about that. Even with trust versus mistrust, we could have some situations there as well. But it starts way younger than what people give it credit for. So we have to be careful with that. Okay. So socialization, the preschooler participates in greater social interaction with both adults and peers. Okay, so remember the toddler here was really interested in parallel play. The preschooler is going to be interacting with pretty much anybody in their life, trying to do like a higher level of play where they might actually like interact with each other versus just playing side by side, but not actually paying attention to the other person. So the development of socialization will depend on the opportunities offered to the child. Okay, so I'll use homeschool kids as a prime example, which I have nothing against homeschool kids. I got a lot of friends that used to be homeschooled, but when it comes to the development of socialization, it will depend on the opportunities that were offered to them as a child. So, most of us, I would say that went to public school, was offered multiple situations of socialization to get to know people and develop conversation over time because we were around others so much. But when you're in the homeschool setting, well, there is co-op and different things like that. But I have noticed even in the many adult human beings that I know now, they are oftentimes decreased in their socialization with others. And the only common source between all these people is that they were homeschooled. So that tends to be something that happens. And not that it's always going to be that way. There's all kinds of different things that you can get kids involved in, sports and church or after school programs or whatever. There's all kinds of different things that they can do to be around others. So there's nothing wrong with homeschooling. You just want to make sure that you have that increased socialization because it could affect their development over time. So moral and spiritual development. Remember, when you hear the word moral and spiritual, I want you to think about Kohlberg's theory. For some reason, this is something that people just get really mixed up all the time. But with Kohlberg, the child begins to understand what is socially acceptable. Okay. They also start having a conscience that is emerging. Okay. So the little Jiminy Cricket on the shoulder trying to tell them what to do, what's right, what's wrong. They also learn self-control and consequences. They want to conform. Excuse me. They want to conform to rules, and this desire increases as the child ages. And the child becomes easygoing with a positive attitude and is less resistant to change and is more secure. So let me go back to this slide and we'll talk about this. I'll show you some things I want you to highlight before we go on to those other bullet points. Okay, so in the book, what you want to highlight is that they're really getting that understanding of good and bad. So a basic understanding of what is considered socially acceptable. They're also learning self-control and consequences here. Okay, so that conscience is emerging in them, and that's where the self-control and consequences comes from. They also are learning right from wrong here, and they do that by listening to and watching and imitating others. So it's kind of just like a trial and error. I mean, as you know, you don't always see things that's correct. Like you go into the nursing home and you probably see nurses do things that they shouldn't do, but you are old enough to know what is right and what is wrong. So this is the stage where that begins to really, really develop. This also is the stage where they really want to please the adults in their life and will do things to create a positive reaction from parents, teachers, and other adults. So that statement really just makes me think of some of these kids that my mom has taken care of in this after school program that she's a part of. These kids don't really get a lot of attention at home, and it'll break your heart just seeing some of the little things that they'll do, like Miss Tara, watch me do this, and they'll just like jump on one leg and she's like, wow, that's really cool. But it's just like a nonstop things like that for like hours on end when it's their playtime of them doing that. And it's just like they don't get that affirmation anywhere else. So when they do get that from somebody, they're going to do anything they can to do this, where they want to please the adults in their life to get that positive reaction from them. So make sure that you have those things that I just pointed out highlighted. So you also want to allow them to help in small ways and receive praise for what they do. So any little thing that they can do to help, even if it's not always super helpful, like maybe you can get a kid-sized broom and let them kind of sweep up the room as you sweep up the room, and let them help you, and just give them, a pat on the back or whatever, a sticker for doing what they did, just to give that positive reinforcement. You want to provide guidance as they interact with a diverse community. They don't always know, how to handle certain situations, different things. So, it's good to just explain, how people do things differently. We do things this way, but other people might do things this way, or, I don't know. There's just all kinds of different things you could talk about in a diverse community, but I'm sure you guys get the general gist of what that's trying to say. You just want to give them guidance in that, and make sure that they, are not walking alone when it comes to trying to figure out how to handle those kinds of things, because they're tricky. More self-assured and well-adjusted by the 5th year, so they feel a lot better about themselves by the 5th year. That they strive for inner control and wanting to please people around them. So that's still going to be there around that 5th year, even though they are more self-assured and well-adjusted. They're still going to have that inner peace, that makes them want to please others. So you want to support by explaining clear and consistent rules and the consequences for breaking those rules. So an example of that would be, okay, I'm trying to cook dinner. You're running around the house, jumping down the stairs. Okay, I tell them to stop. If they don't stop and they keep doing that again, I want to say, okay, if you don't stop jumping down the stairs like I asked you to, then I'm going to have to put you in timeout, because that is not a safe behavior. I'm trying to keep you safe. Do not jump down the stairs. And if they do it again, then you initiate the timeout process. Okay, so that's kind of what it's saying. I know one of the things that we always have heard is like, just do what I tell you, because I said so. And I know that there are some situations where you might want to feel like saying that, but I feel like the outcome is going to be better if you explain your thought process on that. Like, I'm trying to keep you safe here, so please don't jump down the stairs because you could break your leg or your ankle or whatever. Okay, you want to explain, like, I'm setting this rule and this boundary because I'm keeping you safe. Spiritual development surfaces here and becomes familiar with the family's faith, and religious or spiritual matters. So this is the age group where they're going to be asking some questions, maybe about like just where the family faith is, what we believe in. They might ask questions about like God and Jesus or whatever the religion is. Of course, I use the religion that I know the best, but you want to just understand that they're just getting into this. And so the things that you might see are that they have a very concrete conception of a God. So seeing God as a physical being they can draw and talk to and think about. That's something that, like, that's what it means by concrete conception of a God, not just necessarily like, most of our gods are not physical beings here that we can physically, shake hands with or like have a genuine conversation with, but more like a spiritual, like the Holy Spirit kind of a thing, someone that you can talk to like in prayer, but not necessarily a physical being that's there. But at this stage for them, it's like a physical being that they can talk to. They enjoy simple rituals during worship, such as prayers or spiritual stories, different things like that, just depending on the religion. Every religion has different things that they do. Um, and they may find enjoyment in being able to see and touch religious representations, such as like statues or crosses or picture books. A lot of different places like VBS and other things like that, they'll do crafts. So those kind of hands-on things are really helpful to this age group. All right, so temperament is something that we've talked about before, but this highly influences the child's ability to adapt to the new social situations. So every child's temperament is going to be different. We got to remember that it's going to be different. So it assists by selecting an environment that will support the child's temperament. So you got to kind of think about that. What does that mean? Okay, so prime example, when I worked at my old job, one of the things that I did before I left was had them create a sensory room. So if I had a child with, and I say sensory room, and I know that you're thinking like autism spectrum, which yes, those children also, but also a sensory room could just be something nice for genuinely anybody that needs it. I mean, like most of the time, the nurses that I worked with would go in there and just like turn on the little bubble machine and sit on the beanbag chair and just relax for a few minutes. So it doesn't necessarily have to mean like on the spectrum kind of a situation. But if let's say the front desk calls and I have a kid that's out there just pitching a fit, having a bad time, throwing a tantrum or something along those lines, one of the things that I could do by selecting an environment that's going to support their temperament, if I have a kid that's really upset about something, I can take them from the lobby in a situation where there's 50 different noises, all kinds of different people, different conversations, overwhelmingness, and I can bring them into a room where it's just like me and them and get them to a point of calming down. Beanbag chair, put some calming music on or turn a sound machine on or whatever, and just give them some space to where they can calm themselves down. That's what this bullet point is talking about. Okay. So discipline must be consistent and be guided by parental desire for appropriate and safe behavior. So you want to allow the child to develop a sense of initiative while learning self-control and rules. So very fine line of a balance there. Okay. The preschooler will learn how to avoid punishment and how to win rewards at this stage. So one of the things it says refer to the patient teaching guidelines appropriate disciplining in the preschool period. So that's on page 356. Let's look at that real quick. So the preschool child benefits from consistent discipline for unwanted and unacceptable behaviors. So here's some things that we can do for this preschool period. Timeouts should last at maximum the amount of time it takes for the child to understand and recover from whatever behavior was found to be unacceptable. This time frame varies, but a maximum of 1 minute for each year of age. So if they're 5 minutes, 4 minutes, 3 minutes. We've talked about that. If they're in timeout, they need to be put in a quiet and restricted area. Remember when we were talking about this the other day, I always use you all as an example and when it comes to treating kids, because the way you wanted me to treat you is the same as how kids would want to be treated. So let's say that, you did something in class that what I felt like was an unacceptable behavior. And so the thing I did as your disciplinary action was to call you out in front of everybody and embarrass you. I personally don't enjoy that tactic very much. It doesn't work super well, in my opinion. And here's a prime example. Children in timeout should be placed in a quiet and restricted area where they can regain control of themselves and their behavior. You are less likely to react in a positive way if I do things in front of people. The same goes for these preschoolers. If we put them in timeout in front of a big group of people that's watching them pitch their fit and have a tantrum, that tantrum and the fit is going to keep happening for a while because everyone's standing there watching them, and it makes them feel, guilt and shame and all of the things. Okay. So anybody who applies discipline should be fair, firm, and consistent. We've talked about all of that. So things that we can do to try to avoid these situations. We want to put the child in a safe environment. That way they won't start doing things that are unsafe. If we would have them in a safe environment, then they wouldn't be able to do those things in the first place. So we want to avoid unsafe areas. We also want to give explanations of the behavior that adults expect should be very clear and concrete. Okay, so let's say we're playing on the playground, but the playground is not a fenced-in area and there's a road, 20 feet off to the side. So before you even go to the playground, there needs to be a conversation that's had with the preschooler every time that says, okay, here are my rules. We can play anywhere on the playground, but you can't go run into the woods and you can't go run near the road. You have to stay where the playground equipment is to stay safe. Okay. And, no jumping off the steps and whatever. Okay. Different things like that. Parents and other role models should consistently demonstrate behaviors that are desirable. If you don't want them to go in the woods or play in the road, then don't go in the woods and play in the road. I mean, it's pretty straightforward when it comes to that behavior. Parents and other adults interacting with the child should notice that the child engages in desirable behaviors and compliment the child on it. Okay, so that's one of the things that we should do. Okay. Make sure that I didn't skip anything. No. So family relationships. Preschoolers want to conform to patterns, rules, and expectations of the family. Remember, we talked about on the previous page that they are just striving to please adults in their lives and they want to create a positive reaction. So they're willing to do whatever to be able to get that reaction from us. Okay, so they become aware of the rules, functions of each family member and begin to understand sex role functions. Separation from parents become a challenge. Sibling rivalry may be present. And a 4-year-old may act rebellious, aggressive, and provoke frustration if the child feels that the family members are asking too much of him or her. Okay, so if that were to be the case, then the best thing to do is, have them say whatever they need to say to express their overwhelmingness. My niece and nephew will say if they feel overwhelmed, I need space. Okay, so if they start acting crazy and they're upset, you could say, okay, why are you upset? They'll say, well, I need space. I just need space. And we give them that space until they calm themselves down. Okay, but a 5-year-old will become more in tune with the family expectations. Okay, so the thing I really want you to highlight from that section is just that sibling rivalry may present with either older siblings or younger siblings. The age difference really doesn't matter. There can still be sibling rivalry there. Okay, a lot of this other stuff we've already discussed in previous chapters, same stuff, different chapter. Okay. All right. So enuresis. Enuresis is inappropriate voiding, urinary incontinence after the child is successfully toilet trained. Okay, so you want to know what enuresis is. And you're also going to want to highlight what it's associated with. So enuresis may be associated with 1, diabetes, 2, having a small bladder, 3, a urinary tract infection, 4, an overactive bladder, 5, decreased antidiuretic hormone, or 6, constipation. Okay, and of course it says other problems also, but those 6 that I listed, you need to have memorized. Okay, so this could occur if the child is experiencing nightmares, anxiety, a very deep sleep where they're unable to feel their bladder fullness, excessive nighttime urine production, decreased functional capacity of the bladder, and regression due to profound stress or hospitalization. Okay, so any of those things could cause us to have some enuresis in our preschoolers. Okay, so there are 2 types. Primary is where the symptoms occur only at night. Secondary is when it involves daytime symptoms. So primary, nighttime, secondary, also daytime. Okay, treatment includes changes in fluid intake. Okay, so changes in fluid intake is like, what are we drinking? How much are we drinking? And when are we drinking it? Let's not drink, a gallon of water right before we go to bed, kind of a thing. Okay. We also can do some scheduled nighttime voidings just to get the bladder trained. We can do bladder training. Okay, so bladder training is just where we're making them go to the bathroom on a regular basis, like every other hour or every half hour. I'd say it would depend on the situation as to exactly how we would do the bladder training. And then counseling and or medications to increase ADH if that were to be the problem that they have. Okay. So for play, we have associative play. This is when they'll interact and engage in common activity with loose organization and rules. So they have a willingness to exchange materials, although with hesitation, until each child is finished with the ones that he or she is playing with. They may attempt to control or to limit participation when it comes to associative play. Okay. So for this, I really want you to highlight the preschool child actively engages in associative play, which does not have a common goal like cooperative or organized play. So, and then in this type of play, the child may do what we just talked about. Okay, so to encourage associative play and provide opportunity for quiet play that is creative, manipulative, constructive, and educational in nature. Okay, so we want to be able to encourage them to do that, but it's also good for them to have like quiet time, quiet space, just to be able to kind of like grow their own cognitive abilities when playing and learn new things. Okay, so ideal toy selection would be like play kitchens, construction kits, automobile play kits, tool chest, medical and nursing kits. Okay. Okay. Just want to make sure I covered it all. They offer no more than 1 repetition of a project per year of age. Okay. So for play, I really just want you to focus on knowing that associative play is what you're going to associate with preschoolers. Okay. They facilitate learning through play, which is what I was talking about earlier when we're talking about letters and shapes and all those things. If you make it a game, then it's a lot easier for them to learn things and learn them quickly, which we had even talked about the other day. Learning different languages even comes easier for them at this age, because if you make it like a fun thing for them to do, then they will pick up on that super easy and will be able to just speak whatever, different languages. Okay, so easing fears in the hospitalized preschooler. So honestly, like you don't have to highlight this area. This is just something that's like nice to read. And we've talked about a lot of this stuff before. I feel like, we've talked about child life specialists. We've talked about like how you can incorporate play into their day and how you give them a safe space and all the things. Okay. So maybe not everything we've talked about, but some of those things we have if you just want to read over those. Okay, so imaginary friends. Imaginary friends are usually harmless and fairly common. These are comforting in periods of actual loneliness. Um, Man, when you think about it like that, it's really sad. So, they can come and go, but may surface with consistency during life-changing circumstances such as death, relocation, a divorce, or if a best friend moves away, we might see those imaginary friends come back. So there's two types, imaginary companions and personified objects. Okay, so let's see. Okay, well, I was trying to find that part in the book, but anyway, the point of this really truly is just to understand that imaginary friends is something that you might see in the preschool age and that they can come and go. You don't have to have the different kinds memorized, just understanding that it might not be just like truly an imaginary friend like you see it. It could be a personified object as well. Okay. So parents must be aware of their relationships and monitor their effect on the child's safety. So I mean, typically, there's nothing wrong with an imaginary friend, but if the imaginary friend is telling them, go stick your hand on the hot stove top, then, then we have a problem. And that can have an effect on the child's safety. So that's where we as parents would intervene. Okay. Games, arts, and crafts. This age group just loves doing stuff like this. Um, so they do like little cooperative activities or even little solo activities, like little things that they can do, like maybe as a group, but really it's on their own. Like, okay, we're all going to paint a canvas and everybody has their own canvas, or make bracelets and things like that. So box 20.3 on page 358 has got some examples of some play activities that you could do in that preschool age. That's really neat little ideas that would be fun for this age group and appropriate for this age group. Okay. Let's see. So something else that happens in this age group is cheating to win. Preschoolers hate to lose and may cheat in order to win. Okay. Especially when there's a lot of negative talk within. I mean, this is a normal thing regardless of home situation. But if in the home situation, winning is something that's brought up all the time and like success is dependent upon winning, then yeah, they're going to only care about winning and they're going to do whatever they got to do to win, whatever game it is, or anyway. Okay. At this point, it's not a character defect, but rather a normal part of their development. So, when a parent comes in with a preschool age kid, starts freaking out because their kid's cheating on games and stuff, you just want to reassure them that like this happens at this age, and we just want to teach, take those opportunities to teach them manners and truth telling while we're engaging in the games without being coming down on them and being hard on them. We just want to be like, hey, like I saw that you were cheating, and that's really not the thing to do here. The best way have a game and enjoy a game with your friends is to win the right way. So, like, here's how we go about doing that. Okay. And minimizing technology. So we want to do no more than 1 hour a day of any type of screen time, preferably spent co-viewing of a high quality programming with a parent. Okay. That is not happening nowadays, but that is what we have evidence-based practice. No more than an hour a day, and it needs to be co-viewing with a parent if possible. Technology should never be used as an emotional pacifier, meaning they throw a tantrum, you give them a tablet to make them be quiet, they stop the tantrum. Okay, you don't want to reinforce that negative behavior, so you don't want to do that. Changing devices should be outside of or charging devices should be outside of the child's bedroom. You don't want to put anything like that in their room. So on that next page, we're on 358 at the bottom. 5 negative consequences of longer screen times could be childhood obesity, trouble falling asleep, poor academic performances and lower test scores. They're prone to bullying behaviors, attention problems, anxiety, and depression. And they get less creative and imaginary with their playtime. All right, so a few more for playtime. Safe toy selection. So preferable toys include those that are large, brightly colored, and challenging that the child can master. Okay, so games, toys, and crafts that require focused attention, produce an item that can be gifted are ideal. So, like making bracelets and then having the ability to gift that to somebody, it means a lot to them. And that's a great idea as a craft that you could do, or a drawing, a painting, anything like that that you could create. You want to choose games with simple rules at this stage. You don't want to have like a super complicated game that they don't understand. You just want to keep it real simple. Okay, like The Floor Has Lava. Kids love that game these days. Okay, so that's pretty straightforward. The floor is lava. Don't jump on the floor. Okay, that's a super simple thing. Hide and seek. That's a super simple game with simple rules. Or tag. Simple game, simple rules. So you want to assess mouthing behaviors and ensure toys are not dangerous to be placed in the mouth. Okay, so even though they're in the preschool age and hopefully they're not just sticking all kinds of stuff in their mouth still, that still happens. So you want to keep an eye out on that and make sure that they're not putting things in their mouth. And if they are, then you want to take the small things away for that choking hazard. Okay, so protective equipment. Ensure protective gear is the correct size and is suited to the activity. Set rules for protective equipment early so the child learns their importance and remains safer in play. Okay, so, if let's say that they're playing soccer, okay, sports equipment that we would need for soccer, shin guards, appropriate cleats for that. If they play on a skateboard or a bike, they want to have elbow pads, knee pads, a helmet, those kinds of things. All of that stuff, we want to make sure it's appropriate for the activity and it's the right size. If it's not the right size, it kind of defeats the purpose. Okay, so body image here. So when it comes to body image, you want to use the correct anatomical language. Why is that important? Okay, so, well, let's finish out these slides and then I'll share a story of why that's so important. So you want to teach the child that some parts of the body are private. The body is normal and everyone is a little bit different. You want to encourage parents to speak positively about both sexes, okay? Not just speak positively about their child, but speak positively about themselves and the way they view their own bodies and their husbands or their wives, whatever, vice versa situation. You want to talk positively about others and the way they look, okay? Or it'll have an effect on the way that the child could see itself. You want to teach differences in simple explanations using straightforward, age-appropriate explanations to answer questions. Okay, so here's why this is so important. I read a story years ago about a little girl that was in school, and she had told her teacher that her uncle licked her cookie. Well, the teacher didn't think anything about it. She just thought, well, that's gross and weird because it's a cookie and your uncle licked your cookie. Okay. Well, fast forward to long story short, because this is a long lecture. Her cookie was with a term that she used for her vagina, and her uncle was actually sexually assaulting her. So this is why we want to teach our parents to teach their kids the appropriate terms for their private areas or any part of their body. Really, it doesn't matter. Obviously, some things like your PP, like people pretty much know what that means, but people get real crazy with what they try to call these private parts these days. Let's just, shoot it straight. We got a penis and we got a vagina and testicles. Like, let's just call it what it is and call it a day. There's not going to be any confusion if we say it exactly what it is. So, and like to explain differences, like when my niece and nephew, obviously I have a niece and a nephew, they would take baths together. And so they realize that they are different. And so to explain their differences, you just use simple explanations. Sister has a vagina, brother has a penis, brother has a penis because he's a boy, sister has a vagina because she's a girl. This is how everybody is. All girls have vaginas, all boys have penises, blah, 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 blah. Okay. Just keep it real straight and straightforward. Now, while that could make people feel uncomfortable, for a while there after that conversation was had, my niece and nephew would walk up to, people, me, my husband, and say, like, Kay, do you have a vagina? Yes, I do have a vagina because I'm a girl. And they would just be like, okay, and move on about their day. Okay, so yes, it's a little weird for the first, week or two. But after that, it's just what they call their private parts and areas. So you just want to call it exactly what it is to not have the confusion in the long haul and prevent these things from happening. So for sexual development, and here we go talking about Freud again. Okay, the phallic phase, according to Freud, is where they find sexual identity by exploring genitalia and possibly even masturbating. Okay, so a preschooler who masturbates is engaged in perfectly normal and healthy behavior. Okay, this freaks parents out, and honestly, I don't blame them. This has got to be one of the weirdest things that you have to deal with as a parent, because you don't always know what to say or how to say or whatever. But here's what we're going to tell them what to do. Okay, anticipatory guidance for our parents. So we're going to set limits and teach privacy in a non-shaming way when the child shows interest in masturbation. Okay, so you want to teach them that they want to do this self-exploration because they're just trying to figure out their body and how things work. What you don't want to do is make them feel bad for what they're doing, because then there's going to be this whole guilt and shame thing. And you also don't want to just let them do it wherever. You want to teach privacy and appropriateness. That way, they're not in the middle of a restaurant and they just decide to start doing this. You want to teach them privacy and boundaries with this. The child may cause family conflict as he or she competes against the same-sex parent. They may exhibit rivalry and jealousy and will try to win the love of the opposite sex parent. So this is the stage where you'll hear kids say all the time, like, I want to marry mommy, or I love daddy. I want to marry daddy, blah, blah, blah. Okay. They'll do that because they're really trying to identify and be more like the person. If it's a boy, they'll try to identify more with the dad, or if it's a girl, they'll try to identify more with the mom. And then they'll try to get the attention of the parent of the opposite sex more in this situation. So this phase typically resolves with a strong identification with the same sex parent. Okay, so that's the goal, is for them to get that strong identification with the same sex parent. Do you see how important this is in sexual development? We all know how important that is as you get older. If the person that they are their goal is to identify with the same sex parent, if that parent is absent and doesn't show, moral ways or the appropriate ways to react and talk and be with other people, then that can cause an effect on the child as they grow. Okay, sexual curiosity is normal. The child may want to play doctor and examine the opposite sex. Okay, so not that you just want your kid to go up to somebody and be like, I'll play doctor, let me see your private parts or whatever. But for them to want to do that and know that there's a difference between them and someone else is normal. And we just want to, once again, set boundaries and expectations. Okay. Whew, what a lecture, guys. So this preschool age, okay, so preschool is a group child care that occurs before primary school experience and is not a part of the general education that's mandated for minors. So what does that mean? They don't have to go to preschool if you don't want them to go to preschool. That's what that means. However, a lot of people want their kids to go to preschool. They feel like it'll help them get ready for grade school, primary school as they're going in to that. Some people also, it's a matter of work, like they're trying to get back to work, so their kid going to preschool just works better with their schedule. Everybody's different and they've got different situations. So the benefits of this are going to include things like social engagement, or fine and gross motor development and play opportunities, and then skill development and preparation for kindergarten. So once again, we talked about that socialization earlier and how important that is at this age. We really want to push that for our kiddos, and preschool is a great opportunity for that. Preschools often have these little games and crafts and all kinds of little things that they can do that help with their fine and gross motor development. They get all kinds of different play opportunities and skill development that'll help them get ready for kindergarten. Okay, so readiness is based on the child's emotional maturity, attention span, successful toilet training, and sense of autonomy. Okay, what you don't want to do is send a kiddo to preschool that's peeing their pants and is emotionally incapable of understanding rules and boundaries, and all of those kinds of things that we've talked about previously. You want to encourage parents to read to their children to promote learning and provide a positive perspective on preschool to help the child in coping with the new experience. So, you want to ask them, how was your day? And what kind of things did you do at school today? Just to kind of make them feel heard and understood. But you also want to give that positive reinforcement when they're like, oh, I got to do this craft today, I'll get to bring it home tomorrow. And you needed to say things like, oh, I'm looking forward to seeing that. I bet you did a great job, or whatever. Okay, positive reinforcement. Okay, so anticipatory guidance for parents with a preschooler. So what kind of things are we going to do? And this is, you really just want to look at all of these different things, as far as want to make sure I'm telling you correctly. Yes. So when it comes to like health and safety and anticipatory guidance, like what kind of things can we do to keep them safe with their parents at home, we want to make sure that we know those well. So make sure that you're highlighting and or at least reading through these and understanding like why you would do that for this age group. Okay, so you want to focus on health and safety. Okay, there's that word safety again. I told you it doesn't matter how old the person is, from a day old to 99, we are always going to be worried about safety. Number one, many preschoolers are at risk for injuries because of their inappropriate belief that they have a higher skill level than what they actually do. Okay, so what does that mean? That means if you watch Ninja Warrior at home with your kid on the couch, and then they go to preschool and they're on the playground, they think that they are just as capable as Ninja Warrior, and they're going to go out there and start doing some of that craziness, jumping. They'll think that they can jump things that they can't jump, or that they can hold themselves up on the monkey bars longer than what they actually can. Okay, so when it comes to things like that, they're at risk for injury because they think they can do things that they actually cannot do yet. And we just want to keep an eye out on those kinds of things. Okay. So for medical concerns, at least one well child assessment by a pediatric health professional. Okay. So when we get to this stage, I believe we just want to do that one, at least that one well child assessment a year. Of course, if they're sick, then we bring them in more than that, but a one well child assessment every year. We want to do early identification of health problems and prevention of later poorer health concerns. Okay, so we know the earlier we catch things, the better off that person is going to be. So we want to catch stuff early and deal with it. And then if we know that they have a genetic thing that runs in the family, say they have a genetically high cholesterol problem, then our prevention of later poor health consequences, we want to, know that that's something that runs in the family. And we want to jump on top of that, talk to them about healthy diet, exercise, and check in on that with them every time they come in. Obviously, since they're at the preschool age, we're going to educate more our parents than we are the kids, but they are old enough, especially towards the end of the preschool age, to start understanding nutrition, even just basic concepts. Okay. So nutrition and dentition are super important, and we get into dentition later. We've already talked about nutrition. So let's talk about med safety. We're at risk for med errors here. So an indication, scheduling, and side effects should be explained very simply. Okay. So indication, why do we need this? Scheduling, here's how we're going to take this, and then side effects, here's what to watch for after taking these meds. Okay. They're magical thinkers, so they might think that taking a medication is a punishment. Boy, especially if it's like cough syrup or something that just tastes like absolute dog water, like you just want to not take that at all. So if that's the case, then they will think that they might be getting punished. And of course, that's not the true situation, but that might be what they think. At this age, they're really not able to swallow pills effectively, and we may be required to crush pills or mix them with something, create an elixir of sorts. People do all kinds of stuff, just like you do with old people, applesauce, pudding, whatever, you name it. Of course, you've got to be careful because some meds can't be crushed, different things like that. You just got to be careful. But yeah, you can do just the same old stuff that you would do with your elderly with these kiddos. They might fight you off of taking medications. I have to say, in my childhood, my dad became a pro at making sure that we took our meds, especially when they were in this younger age group, and you would just, if it was a liquid, like he would just pop our mouths open and shoot it down the back of our throats, just to make sure that we got our medicine, and we wouldn't be able to spit it out either. So, tips for med administration. You want to give them praise when you're doing this, and you never want to say that medication is candy. Okay. Obviously, I feel like we've maybe talked about this, but maybe we haven't. This kind of stuff pops up a lot around Halloween, but you see that they oftentimes will make actual drugs like THC gummies and different things like that that look just like, Sour Patch Kids, Skittles, Tic Tacs, whatever, you name it, they've made it. You never want to tell kids that medicine is candy, because you're just setting them up for failure. So that's a big no-no. No negotiations, and minimize stalling behaviors. They're going to put you off as long as you will let them put you off. So just don't let them put you off in the first place. And no negotiation. Say, like, if you do this, then I'll do that. Just no, you need to take your medicine because of whatever reason you need to take your medicine, and have them take it. Allow the child to place the medication in the mouth. Okay. I could totally see, especially with this age group, that if you hand it to them, they'll chuck it across the room. I could totally see them doing something like that. So, I mean, yeah, if we could let them take it on their own, that would be great. But realistically, we might not be able to do that. Okay, before we get to dentition, that box 20.4 on page 360, I want you to highlight the things that participate in recommended health screenings. So all those bullet points that come under that, you're going to want to know those. So make sure that you've got those highlighted and you've got those memorized before our exam. All right, so talking about dentition, primary teeth may shed to prepare for the eruption of the permanent teeth. Dental hygiene practices such as brushing regularly to prevent caries is important. Encouraged to brush their own teeth while providing supervision. Okay, you don't want them, you leave them unsupervised, then the entire bottle of toothpaste is going to end up in the sink, and they're going to eat half of it. So, you want to stand there and watch them do that. And also just to make sure that they're actually brushing their teeth well. And then maybe you can hit the spots for them that they didn't get super well. Severe tooth decay in primary teeth can cause decay to emerge on those permanent teeth as they come out. So we want to try to prevent that as much as possible. And thumb sucking. I was a thumb sucker growing up, and this can be really disruptive to tooth alignment. And that is very true. So we want to try to get them to not use thumb sucking as a coping mechanism. It can be really difficult to stop. Some parents choose over-the-counter products to apply on nails to provide an undesirable taste. I particularly was a tough nugget to crack. My parents tried almost everything with me when it came to thumb sucking, and I just did not care. They would put stuff on my nails all the time, and I would just suck it right off and just keep doing what I wanted to do anyway. But the thing that really got me was when I was about to go into preschool, kindergarten, I don't know, something like that. And they told me that people were going to make fun of me. That's what made me stop. So every kid is going to be different on how you get them to stop. Sometimes it's like the littlest things that get them to listen to you. But anyway, regardless, we want to try to get them to stop with the thumb sucking as soon as possible, so we won't have those issues with our dentition. Okay. So healthcare terminology. Preschoolers are afraid of bodily harm and become fearful in hearing medical terminology, which is what we call medical jargon. Okay. And this is what I was telling you guys the other day. I want you to feel comfortable with having a conversation with a toddler all the way to a 99-year-old. You need to be able to have an adult conversation and break it down in a way that anyone of any age, regardless of their education or their background, can understand what you're saying and be taken care of well and efficiently. You want to make sure that you're doing that. Okay, so, when we're talking about preschoolers, it's the same here. You want to discuss specifics of the child's illness or injuries with parents away from the preschooler. Okay. You don't want to, you want to tell the preschooler the gist of what's going on. But you don't want to use all the proper terminology and the intimate details of everything that we have to do. That's a conversation to have with the parents outside the room. Okay. So contact a child life specialist. So that's on page 361, child life services. So this was something I think we've talked about this before. It might have been in a previous chapter. But child life specialists are experts in child development. These people literally walk around the hospitals with buckets of toys and go and play with sick kids. Like, that's their job. And they explain the procedures that they might be going through, or the illness that they have with the toys that they have them play with, or sometimes they just go play with them because they're stuck in a hospital, especially kids that end up having like cancer and different things like that. You'll see people like that on those floors often. Okay, so when it comes to medical play, this reduces stress and anxiety of hospitalized preschoolers. So we want to get familiar with this and know how to do this well. You want to involve those child life professionals, like that's literally their job. So we would put a referral in for those guys to come in, but not all hospitals have those guys. So when we don't have those guys, guess whose job it is to get it done? That would be you. So regression is a reaction to the stress and anxiety felt during hospitalization. Do not reprimand the child, but rather give assurances that he or she acted bravely during the scary experience and that the child is safe now. Okay. So the part that you want to highlight, there's a couple parts under medical play that I want to point out to you. The part that you want to highlight is that under that second paragraph on page 361 under medical play, medical kits, plastic syringes, cotton balls, adhesive bandages, tape, gauze, and stuffed animals or anatomically correct dolls can be used to stimulate a previous experience or expected experience with the kiddo. So you want to highlight that part. You also want to highlight box 20.5 on page 362. Okay, so that gives you some more ideas of things that are appropriate to do when it comes to medical play. Okay, so screening and health promotion for the preschooler. You want to begin to assess for health issues. Vision screening, so we've already talked about that. Nearsightedness, double vision, we want to check for these things. Additional screenings, any evidence of neglect or child abuse that we might see. Okay, we've talked about that enough. I think that you guys might feel okay about that, but I also think we might talk about that more later in a different chapter, maybe. Nutrition and obesity, which we've also talked about before, so there's not much more to say. Language development, we talked about what we kind of expect with them, and like I said, sometimes they'll get those things done before the age that is expected, but the problem becomes when they do it, they don't achieve those goals when we expect them to. Okay. Head Start offers height, weight, and blood pressure screenings for children that's enrolled in their programs. So that's a plus that we might want to tell our parents that might be interested in doing those things. It's also worth knowing that preschool children might need booster shots for the DTaP, IPV, MMR, and varicella. So what this is from Yeah, I don't think we have a chart on it in this chapter. But that last chapter, the chapter before, we had a little chart where it talked about the booster shots. If you'll go where I posted in announcements and look on that chart that I put up there from the CDC, it'll talk about when we give what vaccines, okay? And that's just the regular chart from the CDC. There's a couple of others for like delayed immunizations, like if a parent doesn't want to give their kid 4 shots at a time or something like that. Okay. But for now, the immunization boosters that we're giving before preschool is the DTaP, IPV, MMR, and varicella. We want to make sure that we've got all of those things. Safety in hospitalized preschoolers. So you want to observe precautions to prevent injuries, accidents, and medical and medication errors. Okay. We talked about this the other day when it comes to errors that could happen on our part, like medical medication errors. If you want to go into peds, you better be on top of your game every day when you go into work. It's really easy to get stagnant in your job and just kind of go roll with the punches and go through the motions. But you really don't want to do that because that's how medication errors happen. You want to, double, triple check yourself before you walk into a room for anything, anytime. Super important that you do that. And it's not beyond, like, stuff like that happens every day. I have a friend that works at the pediatric wing in Johnson City. She literally had a new grad student that gave a pediatric patient insulin, and it wasn't even for that patient. He gave the medication to the wrong patient. So he gave somebody insulin that didn't need it, and the patient that did need insulin didn't get it. I mean, and you guys all know how insulin works, so you can imagine how bad of a situation that could have been. Okay, so make sure that you're checking yourselves and being super careful. You want to apply that security alarm device on the child's ankle or wrist to prevent abduction or wandering off the unit. We've kind of talked about those before when we talked about babies, but they also have those on older kids as well. Place safety covers on electrical outlets and devices on IV lines to prevent injuries to the patient. For the unaccompanied patient, you have hospital personnel monitor the child. You never want to leave them unmonitored, although I feel like in real life that's probably not what happens, but hopefully it does, but I bet not. You want to place them in a high top crib if that were to be necessary, especially on the younger end of preschool age. When they're 5, a high top crib's not going to stop them. But maybe towards the beginning of that preschool age, that might be something that would work for that. You want to assign them to a bed that's close to the nursing station if they're unaccompanied. That way you can keep a better, closer eye on them. The best way to maintain safety is by having a family member remain with the child. So ultimately, that would be our best shot at keeping them safest, is someone being with them 24/7. A constant supervision while in the nursing unit playroom as well. And for all the same reasons as usual, choking hazards. Um, you don't want to put them in the playroom and leave them alone and then come in and they're jumping off the tables and doing all kinds of craziness. We want to make sure that we're on top of this stuff. Okay. So when it comes to injury prevention for the preschooler, these bullet points you want to have memorized. And you can highlight those in your book. Provide anticipatory guidance to parents and caregivers on preventing injuries and accidents in the following areas. So drowning, poisoning, fires, burns, falls, sports injuries, motor vehicle related injuries. Okay. So make sure that you've got those memorized. Sorry, I need to make myself a little note here. Do not allow preschoolers to play in the garage, kitchen, or yard without adult supervision. You want to educate the child on safety in both the home environment and the school environment. And then you want to teach safety about car seat safety. Okay, so where does it talk about that? Oh, so the patient teaching guidelines on 362, parents of a preschool children must be taught to secure them in approved appropriately sized front facing car seat in the back seat without airbags. Many preschool children can safely ride in a booster seat with a snug fitting strap over the shoulder and against the top of the legs. Children should not ride in the car with a seatbelt only until they are at least 57 inches tall, or that's 4 feet and 9 inches tall altogether. Okay, so make sure you're looking at that. Disorder of the preschooler. So particular health concerns include common infectious diseases and encoparesis. Teach parents and caregivers the prevention and early recognition of common childhood infectious diseases to prevent the spread of the disease and minimize the risk of complications. So I'm sure in your mind, you're sitting here thinking like, I mean, okay, but what am I supposed to talk about? Well, there's a lovely little table for you on page 20, or it's table 20.3, page 363. Now, I'm not going to make you memorize all of these signs and symptoms. A lot of this stuff you've probably heard of before, but just to know that when you're teaching parents of what different things to look for, you know, like we'll use whooping cough. The hallmark symptom is an uncontrollable violent cough that's sometimes followed by vomiting. Remember, we've talked about this before with whooping cough. Sometimes it sounds like a seal barking, is how people describe it. So it is like a deep, horrendous cough. And we would want to teach our parents, watch out for these signs and symptoms of these different things, because they could have, you name it, these common infectious diseases that we're talking about here. The part that I really want you to know is the health promotion on page 365. So teaching preschool children to avoid germs. Okay, so young preschool children require instruction, supervision, and support in learning how to reduce the chance of acquiring and spreading infections. The following are some of the healthy habits to encourage the preschool child. So you want to have them wash their hands immediately upon coming home from school. Okay, this alone, it says, can reduce the common cold by 50%. Wow. Okay, children wash their hands right before they sit down to eat. Okay, remember we talked about kids are gross. They'll literally stick their hand down their pants and scratch their butt and then put their hand in their mouth right after, not thinking about it. Okay, so we want to teach them that if they do anything like that, they need to wash their hands, and especially before they eat, because they'll be picking stuff up and putting it in their mouth. Okay, instruct children to not share dishes, cups, or eating utensils with others to reduce the chance of spreading germs. You want to discourage them from feeding younger siblings bites of their own food with their own eating utensils. You want to encourage children to wash their hands after play outside to reduce the amount of soil, dirt, and animal dander and germs from playmates entering the house. You also want to teach children to cough into their elbows and not into their hands to reduce the spread of germs. You want to teach children to use tissues when sneezing and blowing their nose. Often young children will just wipe their noses on their sleeves and blow their nose into their hands and then wipe their mucus all over their clothes. That is so gross, but I guess somebody's doing it because it's in here. If the child is exposed to a cold or other infectious disease during play, you want to wipe all toy surfaces with a commercial cleaner, such as an antiseptic household cleaning wipes. You want to clean thermometers after each use, even when it's used repetitively by the same child. Okay. You also want to look at that patient teaching guideline of hand washing for preschoolers. Okay, a lot of that's just common sense, but make sure that you're looking over that and reading. All right, so we're getting close to the end here. Encopresis. You need to know what that word is. Okay, so this is also called fecal incontinence or soiling. It's a medical diagnosis given to a child 4 years or older who had previously achieved potty training and is now soiling his or her clothing during the day. Children experiencing severe constipation and colon stretching and a decreased sensation that they need to pass stool. Okay, so this does happen occasionally where they'll have a decreased sensation that they need to pass stool, and it's not that the stool's not there, it's just that the sensation is not there. Okay, and then obviously you can only hold so much before you end up pooping on yourself. Okay, so this affects about 3% of children between ages 4 and 12 years old. A medical problem that requires intervention and not an emotional behavior or developmental issue. Okay, please take a look at that second bullet point and make sure that you understand that when it comes to this, we need to educate our parents very well and make sure that they understand that this is not because they did something wrong as a parent. This is not because the child is just not behaving well or whatever. It's not a developmental delay. It's a genuine problem that happens in 3% of kids. Okay, so you just want to affirm them in that. The pathophysiology, this begins with stool collection, retention, and impaction in the colon. The colon enlarges and the intestinal walls and the nerves located within that area will stretch, thereby it diminishes that nerve sensation. Okay, so here's what happens. They don't want to go to the bathroom. Okay, so they'll hold it, which is retention. It can cause impaction in the colon. Impaction will make the colon get bigger and bigger and bigger. The intestinal walls get spread wider and wider and wider, and the nerves within those walls start diminishing in sensation because of all the stretching. Okay, so the lack of sensation or the urge to defecate occurs. So they can't even tell that they have to go to the bathroom anymore. Or if they do, it's too late and they're going all over themselves. The child also loses the ability to contract and push the stool out. The intestinal wall continues to stretch and large, hard stools are retained. Liquid stool seeps out or leaks out around the fecal mass. Really appreciate all this intimate detailing that they're giving us. Goodness. Okay. The stool is passed without the child feeling it until defecation has occurred, typically in the late afternoon or after school. Okay. So our risk factors would be anything that we could give them that could cause constipation, like cough syrup, if they have anxiety, or if they have depression, ADHD, or autism spectrum disorder. All of those are risk factors for this particular process. The symptoms would be severe constipation, obviously, that would be accompanied with that abdominal pain from being so constipated, lack of appetite, avoidance of bowel movements, and then when they do go to the bathroom, they pass large amounts of stools that frequently clog the toilet. Okay, so interventions. This is what you want to highlight when it comes to encopresis, aside from just knowing the term. You want to encourage the child to sit on the toilet for at least 10 minutes several times a day in an attempt to pass at least a half cup size stool. You want to provide the child with a high fiber diet with lots and lots and lots of water. Okay, the family must work together to diminish the emotional aspect of the condition during the long treatment. This is not something that's going to get fixed overnight. You want to make sure that everybody understands that and everybody just works together to overcome. Okay, So our overall treatment goal is to have a daily normal bowel movement, to reduce stool retention and heal that stretched large intestine area, and to have the child gain control of their defecation, and to resolve any bad feelings such as guilt, frustration, and any family conflicts that may have come from this. Limiting or eliminating consumption of cow's milk and other dairy products may alleviate some of these symptoms. Whew, and that was it. That was a super hefty chapter. That was the end of chapter 20 for the health promotion of a preschooler. So if you guys have any questions, you can reach out to me on Canvas. Happy to help you out in any way that I can. Just let me know.